So good afternoon. I'd like to start out today with an update on our COVID-19 data. Yesterday, 6,481 tests were reported across the state. That brings our total to 1,058,000 tests which have been administered here in Massachusetts. We have been and continue to be a national leader in testing on a per capita basis, thanks in large part to the growing network of labs, hospitals, and community health centers that have been offering tests to a broad range of residents. Our goal is to continue to test large numbers of individuals across the state every day. Coupled with our contact tracing initiative, we'll use all available resources to understand and monitor infection rates and continue to contain COVID in our communities. Our administration is also broadening our approach to detect population-level screening for COVID-19. Last week, the Executive Office of Energy and Environmental Affairs announced a pilot program through the Massachusetts Water Resource Authority to test wastewater for early warnings of COVID-19 at the Deer Island treatment plant. Samples will be collected 3 times a week from different regions with results sent to DPH. We're hopeful that this pilot can be another surveillance tool for the Commonwealth to monitor where COVID-19 exists so that we can have a more targeted approach to quickly isolate and slow the spread of any infections. Yesterday, there were 101 new positive cases reported. The 7-day average for the positive rate remains at about 1.9%. That represents about a 93% decrease from the end of May. There are currently 762 patients hospitalized for COVID-19 statewide, including 138 patients in the ICU. My remarks say the end of May. I'm pretty sure that's the middle of April. Sorry about that. There are currently 762 patients hospitalized for COVID-19 statewide, including 138 in the ICU. I was on a call this morning with most of the hospital systems in Massachusetts. Those numbers fell again last night, which will show up in the reporting that's released today. The 3-day average number of patients in the hospitals is down 79%. 2 hospitals have reported they're still using surge capacity to serve patients, and our public health information continues to show a downward trend in our key metrics. This obviously represents solid progress as we head into July and will continue to influence when and how we move into the next phases of reopening the Commonwealth. I can't say enough about Massachusetts hospitals and the tremendous job they've done treating people who are dealing with COVID and helping people get back to their daily routines and continuing along the way to continue to treat non-COVID patients as well. As I've said many times from this podium, please don't hesitate to contact your health provider about any healthcare concerns you may have, COVID or otherwise. Telehealth currently is a covered benefit here in Massachusetts. Many clinicians and many patients have taken full advantage of that over the course of the past 115 days or so. And Massachusetts, which continues to have one of the very best healthcare provider systems in the country, is open for business and making sure that they are there for you if you need them. Everyone has done a tremendous job helping the Commonwealth slow the spread of COVID. And on June 22nd, Massachusetts was ranked as having the lowest transmission rate of COVID-19 in the country by a group of academics and statisticians that monitor state data. None of this would have been possible without everybody playing their part. Individuals and families have followed the medical guidance by practicing good hygiene, social distancing, wearing face coverings, and staying home if they're sick. It's working for us, but we clearly need to stay on our game. As I've said before, COVID-19 will not be taking a summer vacation, and the way we deal with it should continue to factor that into our daily decision making. And as we've all seen, several other states are seeing sharp increases in new cases and hospitalizations, which is a very real reminder to all of us about just how contagious this virus can be. Everybody should continue to be vigilant in their daily activities, and if they travel as we approach the 4th of July weekend, they should be especially careful. Thankfully, businesses are reopening and all kinds of activities are resuming. And I know that many people are looking forward to planning a few days out of town at some point over the course of the summer. For lots of people, that probably means staying a little closer to home, somewhere around New England or in the Northeast. Massachusetts is reopening, but we want to make sure that our out-of-state visitors are also taking appropriate precautions. Due to lower infection rates across the Northeast region, our administration is updating our state's travel guidance. Effective July 1st, all travelers arriving to Massachusetts, including Massachusetts residents returning home, are instructed to self-quarantine for 14 days, unless they're travelers from Rhode Island, Connecticut, Vermont, New Hampshire, Maine, New York, and New Jersey. These surrounding states, like Massachusetts, are seeing a significant decline in cases and new hospitalizations. Travelers arriving to Massachusetts from these 7 states are exempt from the 14-day self-quarantine directive. In addition, workers designated by the federal government as essential critical infrastructure workers continue to be exempt from the directive for work purposes. Of course, all people are instructed not to travel to Massachusetts if they're displaying symptoms associated with COVID-19. We believe this change reflects the facts on the ground and is consistent with the Commonwealth's approach to COVID-19 standards generally. We're home to many destinations that people usually travel to visit from all over the world, and there's no doubt this season will be different and immensely difficult for visitors and businesses. It's our hope that many folks will still be able to visit their favorite places in our great state. And we've proven that with some changes, a lot of patience and hard work, we can reopen and continue to fight COVID. As everybody knows, we've been battling this pandemic for months. It's been hard, it's been difficult, it's been frustrating, and at times it hasn't been pretty. And it's made it very difficult for any of us to keep up with our daily routines. But we've made a lot of progress in containing COVID-19. Our hospitals are delivering the world-class care that they're known for to non-COVID patients as well as COVID patients, and we've made it through 2 major phases of our reopening plan at a good pace, made possible by declines in key health metrics. We now know there's a long road ahead of us, and we have to continue to play the hand that we've been dealt. And we do not want to take 1 step forward and 2 steps back as we keep climbing out of this horrific pandemic. So please help us stay ahead of the virus and prevent the spread through the simple steps we talked about before: face coverings, hand washing, hygiene, and social distance. We are enormously grateful for the efforts and cooperation and strong spirit our residents, our employers, and our colleagues in government have delivered time and time again over the course of the past several months. And we look forward to a safe and responsible 4th of July weekend. With that, I'm going to turn it over to the Lieutenant Governor.
Thank you, Governor, and good afternoon. Governor Baker and I have always said that Massachusetts is only as strong as each of its 351 cities and towns. Strong communities make a stronger Commonwealth. And it's our job in state government to make sure every municipality has the resources and support they need to take on the challenges they face. Before this crisis began, we were dealing with a housing problem. We also had thousands of families struggling to make rent in one of the most expensive rental markets in the nation. It's why we've made housing a priority every year through increased funding and have sought to change the playing field through our housing choice legislation. Since this pandemic began, it has highlighted the importance of shelter and having a safe and stable home. And as we look forward to continuing a safe and successful reopening, we need to ensure all families and all households have access to housing. In March, we announced an emergency infusion of $5 million into our main homeless prevention program called RAFT, which serves low-income communities. But we know the need is even greater. So we are pleased today to announce a new rental assistance program, the Emergency Rental and Mortgage Assistance Program. This $20 million fund is a mix of federal funding the Commonwealth received from the CARES Act and other federal reserves, and will expand access to emergency housing resources for more families in need. The goal here is simple: provide housing stability. If you are a low-income household that is facing financial hardship related to or exacerbated by COVID-19, starting tomorrow, you will be able to apply for help with your rent or your mortgage. Eligible families can apply through 11 regional raft administrating agencies, such as Wayfinders in Springfield, Metro Housing, Boston, and Community Teamwork, Inc. in Lowell. This funding is part of a larger strategy our administration is pursuing to ensure we keep people housed and families whole. DHCD has received more than $160 million in funding through the Federal CARES Act. This funding will support various programs to address the economic effects of COVID-19 on our communities. This includes more than $10 million that will fund the Emergency Rental Mortgage Assistance Program, which will provide up to $4,000 per household. It also includes $22 million in community service block grants for our community action agencies to undertake important anti-poverty work. Recovering from this pandemic will require that we act in state government, and that's why we proposed a $275 million economic recovery and equity legislation on Friday, and we discussed that with you. That package includes substantial support for communities and affordable housing, new language that modifies income thresholds to increase affordability, as well as the critical housing choice reforms that are needed here in our Commonwealth. The bill the governor filed to increase the supply of new housing is not new, but it's more important now than ever. We can see the effects of too little affordable housing, too many families living on the edge of eviction, too many households doubled up, and too many of our people in unsafe living conditions. The funding we are making available is important in the short term, but we know there was a housing crisis in Massachusetts before COVID-19 hit. We cannot address the housing issues of 2020 without the restrictive housing laws changed that are on our books today. Thank you. I'd like to now turn it over to Secretary Setters.
Governor, Lieutenant Governor, good afternoon. Essential to our reopening progress have been our local boards of health and their efforts these past few months. Today, the Department of Public Health will release a reminder to all of our municipalities regarding the existing guidances that are in effect, important particularly as we come to the 4th of July weekend. The letter also recognizes the important role of our local boards of health as the experts on the ground. Throughout the pandemic, the Commonwealth's local boards of health have been key in slowing the spread of COVID-19 in our communities. Local public health officials play an essential role in promoting health and preventing disease. Their efforts during the pandemic have required an around-the-clock response. From the earliest days of the response, the local public health workforce has been essential in educating the public about the risks and symptoms of the virus, as well as ways to prevent its spread. Local boards of health have also been key in the contact tracing efforts. The reason it's called the Community Tracing Collaborative is to promote the collaboration of local boards of health, community health centers, and partners in health. Local boards of health work directly with other local government officials, including town managers, select persons, local law enforcement, and first responders, to ensure that the public health orders and guidelines are complied with in order to protect our collective health. We're grateful for all the work that local boards of health have done over the past few months. Early on, we provided $9 million directly to local boards of health in anticipation of their increased responsibilities. Last week, we announced another $156,000 for a total of $500,000 to help local municipalities to share public health resources more effectively and efficiently. We'll continue to support our local boards of health and work closely with them, primarily through the Department of Public Health and their regular contacts, to help guide the local public health efforts throughout all of these challenging times. Thank you. Governor?
Questions?
We spoke with an epidemiologist yesterday who said she was concerned about people coming in from some of those hot zone states and potentially spreading the virus here. She suggested tougher enforcement, maybe at airports or even stopping cars, fines. Did you consider any of that, and why or why not have you decided to implement it?
Well, we've had a 14-day quarantine advisory in place now for quite a while, and generally speaking, people have been pretty good about complying with it. What we thought we should do today, given the facts on the ground, was to make clear that the states that basically surround us here in the Northeast, all of which have had very positive trends for the past several weeks, people in those places should be allowed to come to Massachusetts without having to live up to that 14-day quarantine. But generally speaking, people have been pretty good about abiding by this to date.
How do you know that? The advisory really has, respectfully, no teeth. It's a suggestion, essentially.
Most of the data, the information we get about it comes from the lodging community, which says it's been a very effective tool to limit the number of people who come here. The fact that there's a 14-day quarantine has been, based on almost every conversation we've had with those folks, a real limiting factor with respect to people's willingness to rent or, book an Airbnb or a motel or a hotel room.
Is this an effort on your part to help businesses that really rely on the summer, given the data is heading in the right direction, businesses on the Cape, Berkshires, this is do or die for them?
Well, I think the point we tried to make with this was to point out the fact that the states directly around us here in the Northeast all have very positive trends with respect to COVID penetration generally, and have done many of the same things that we've done to put themselves and their populations in that position. And we felt it was appropriate at this time to basically take the quarantine off for those states that are referenced. They happen to be nearby. If it turns out that factors into a decision that people make to come to Massachusetts from those areas, so much the better.
You mentioned one of the constitutional issues.
Massachusetts, a lot of people want to go to Rhode Island, or Maine was requiring some sort of proof that you tested positive within a certain time of staying in the lodging. What's the general rule of thumb to families trying to figure out what to do in the next few weeks?
Okay, I'm not sure I understand the question.
The leaving Massachusetts,
Yep.
obviously you're letting some of the folks in without quarantining, but what is the general advice to families who want to get up to Maine and stuff like that? Maine was actually requiring certification that you tested negative within a certain range.
I think different states have different rules, and ours are right up on our website for those coming here from outside Massachusetts. The other states have the rules up on their websites with respect to what the rules are there. I think in some states it's statewide, in some states it's done by county. Part of our issue here was to try to do something that was relatively simple so it would be fairly easy for people to understand and comply. I think one of the challenges we've heard from some of the folks in the lodging community is if you're constantly changing the rules based on scores and by county, you make it very difficult for the folks who are trying to follow the rules to actually know what they are and abide by them.
But is it safe for them to leave, in your opinion, just from the health data that you've seen, to leave go to those states that you're allowing to come in?
Well, I think we'd like to see them go to the states that have the same kind of current positive test trends that we have, which would be the ones that are generally around us. Yeah.
What were some of those constitutional issues you were talking about last week? We've seen in New York, they're levying fines. Could you do that? Is that something you could do?
There are real constitutional issues associated with limiting travel between states. Yeah.
Governor, do you run a risk of Massachusetts sort of becoming an island here, where Rhode Island, Connecticut, Maine, upstate New York, all have these sort of restrictions, and then Mass, which is a popular vacation spot, does not?
We have the same restriction that the rest of them have. We've had it in place for almost 2 months now. 14-day quarantine if you come here from someplace else. What we're doing is basically adjusting that 14-day quarantine to say that for those states that are sort of around us up here in the Northeast that have very low positive test rates, there won't be a quarantine. But the quarantine still exists for everybody else.
So for those announced a fund for people who are struggling to pay their rent or mortgage, some advocates and lawmakers actually are calling on you to extend the moratorium on evictions and foreclosures beyond August. Will you?
Well, first of all, there's a lot of resources at work here. The Lieutenant Governor talked about the $160 million in federal funds that flow either through our housing operations or directly to cities and towns. That's on top of the roughly $900 million that's already been put out to cities and towns to be spent on COVID-related activities, of which this can certainly be one. We continue to talk to folks in the housing community about what some of the key issues are, but I don't think we're in a position to make a decision on that today.
Governor, do you consider the coronavirus contained in Massachusetts, given the low infection rate, positive rate, or is it contained in some other parts of the state, some certain parts of the state?
Well, I guess what I would say is that if you look at the testing data, which is up dramatically from where it was 60 or 90 days ago, and you look at the number of positives, they're down dramatically from where they were 60 or 90 days ago. I would call that progress, and we talk quite a bit about the work that's been done here to contain the virus. And the reason we use the word contain is because I don't want anybody to think for a minute that it's time to let down your guard. There's plenty of evidence, not just around this country, but around the globe, of places where people have let down their guard and the virus has come roaring back. And I think continued vigilance with respect to this is the way you contain it. And one of the things I've been most pleased by has been that a lot of the folks who've looked at the work that we've done here, especially with respect to the contact tracing program, have commented on the fact that Massachusetts, generally speaking, hits a really high percentage of the people who test positive very quickly and also manages to get in touch with a fair number of their close contacts. I don't know how anybody can contain this without having a pretty robust testing program and a pretty robust tracing program. And you're likely to see that continue to be part of our strategy to contain the virus going forward. But I view it as an ongoing issue. I don't view it as a, today we contained the virus. I view it as something we need to do every day, and we'll probably continue need to do for months.
You talked about this 14-day quarantine.
Pardon me?
You talked about this 14-day
Yeah.
quarantine before, but I just want some clarification. It's not like a mandatory requirement, right?
It's an advisory.
It's more advisory, so.
But it definitely has had an impact, according to the lodging community, on people's willingness to make reservations.
So, but I guess my question is, like, people working in the South, they're turning the hotspots down there, and they could choose to ignore your advisory.
And they could do the same thing in every other state, too. It's an advisory. But generally speaking, it has had an impact on the decision-making with respect to where people go.
Do you think it's within the scope of your powers to make it mandatory to quarantine for 2 weeks?
That's where you run into pretty interesting constitutional questions.
Governor,
The contact tracing effort you talked about,
Yep.
want to maintain. Hearing reports of pretty large layoffs at partners that help that, maybe 400, 500 people. What are the true numbers? What do you mean?
I don't know the exact numbers, but there has been a significant reduction in force. There's two reasons for that. First of all, a big part of the reduction, some cases, was people who came to work for the program who actually didn't work for the program. They worked for somebody else. There were a bunch of folks from Blue Cross Blue Shield, for example, I think 100 or so, who came to work for the program, who went back to work for Blue Cross. There are many other people who took a voluntary riff from the program with the understanding that if they need to be called back, they would like to be called back. But there's no question that if your positive test rate goes from 30% to 2%, you're going to have less work for those folks to do than you had for them to do when your positive test rate was 30%. Our goal here is going to be make sure that we can move the thing up when we need to as we go forward here if our positive test rate goes up. And I believe we'll be in a position to do that. I also think one of the things you should remember here is the reason we called it a collaborative in the first place was it was a support system for local boards of health. And if the local board of health can actually manage the incoming as the numbers come down, then there's less sort of overflow that goes to the folks who are doing the collaborative part of this. They're all working on the same database, and at the end of the day, all their information ends up in the same Maven system that's housed by the Department of Public Health. But if the local boards can manage it, that's sort of the first stop on on the process here. It's only when the local boards get overwhelmed by the numbers they're seeking to deal with that it flows over into the collaborative. So I do believe, yes, it's true, the numbers have come down, but a big part of that's because the numbers overall have come down. If the numbers start to go up, we have the infrastructure in place to scale it back up pretty quickly.
When do public boards expect to see the
There was
governor?
a local board of health in North Brookfield that has asked you to step in to stop a 4th of July celebration. What are your thoughts on maybe overruling a city and town about 4th of July celebration?
Well, obviously, we recognize and understand that a lot of what we've been doing to contain the virus here in Massachusetts is difficult for people, and we've had a very strong relationship with our colleagues in local government to manage our way through that. And we've also talked about the fact that large gatherings come with consequences, okay? And I think it's our hope that most folks don't do the big, large 4th of July gatherings, and for the most part across the Commonwealth, they're not. And those are obviously in violation of many of our gathering rules. And I would hope that North Brookfield would take the same position. I do know that our Department of Public Health has been talking to the local board as well as to the select board out there about our concerns.
Governor, will people expect to see, Governor, when can people expect to see, thank you, when can people expect to see a coordinated effort to test asymptomatic people across the board? When can we expect to see that sort of thing?
Well, we do test asymptomatic people now. We test asymptomatic people if they're close contacts of people who test positive, and we also tested a lot of asymptomatic people when we did the pop-up.
Right.
We're going to continue to work on developing strategies with our colleagues in local government and in the community health center community generally to come up with strategies to test on a go-forward basis, and we'll continue to have more to say about that.
Governor,
Yeah,
there's
there
been
are public health
altercations
officials. You
about
had
masks.
mentioned
People
this
have been
last week.
altercating about masks and stuff. P-Town, there was someone who was actually attacked for asking someone to wear it. We've seen it firsthand where people just, what's the general comment about that? People want to do the right thing. Some people are saying, they don't believe in wearing the mask. It's turning into an altercation.
Well, I guess I'd start by saying that the overwhelming majority of the people in Massachusetts have been really good about abiding by the rules associated with wearing a face covering if you can't socially distance, and that has been the policy, not just that's come from us, but that's been the policy in most local communities as well. There's been very little gray around people's interest and commitment to that, and more data that's come out that makes pretty clear that that face coverings, particularly worn by both people, if you can't distance, is by far and away one of the most effective ways to slow or stop the spread. And I think that's proven in a lot of the data that exists here in the Northeast, where for the most part people have been pretty good about that. And I would hope that everybody would recognize and understand that people are wearing masks because they keep people safe. They keep the person who's wearing the mask safe, and they keep the people they come in contact with safe. And I get the fact there's a lot of anxiety out there about all kinds of things, but I think on this one, people should be responsible, should wear a mask, and should recognize, if they can't distance, and recognize and understand that that's a good thing for them and a good thing for the people they come in contact with.
Local boards of health are saying that they're dealing with a fractured public health infrastructure, lack of funding on their end. They're saying that COVID-19 test results are coming sometimes 2 weeks after someone in their community is tested positive. One recommendation they made for the state is, as the state reopens, to consider or reconsider universal testing. What is your stance on that currently?
There's no country, no state in the world that thinks universal testing is the answer to COVID. And even the countries and the communities that have been the most successful in managing this have been successful not because they have universal testing in place, but because they have a universal commitment to doing the things that stop the spread. And they have very strong and well-developed outreach programs and contact tracing programs and isolation programs for people who need the support to be able to isolate. Face coverings, hand washing, hygiene, distance. Those are the most powerful tools that are available to regular citizens to stop the spread. The availability of PPE was an enormous issue, not just here, but in all kinds of places around the world for all kinds of reasons. It's gotten better, but that's going to continue to be a significant issue for those of us who want to make sure that first responders and folks in law enforcement and healthcare workers and those who deal with vulnerable populations and those who work in congregate settings continue to have access to the gear that they need to stop and manage the spread. Testing is a vehicle for determining how well you're doing with the devices and the protocols and the policies that you're putting in place to manage the spread of COVID. But it is not by itself a solution. It's a tool you can use to determine how successful the approach you're taking is performing. And I think it's really important for everybody to understand that. There's so much more about what we can do to stop the spread, and that's really where it needs to start.
And what additional steps are you guys taking to maybe make sure everyone's communicating on all levels, from boards of health to HHS? Are there any steps to maybe continue training or communicating some of the new guidelines?
Do you want to speak to this?
So about 2-3 weeks ago, the Department of Public Health created the Assistant Commissioner for what I'll call local boards of health, Jana Ferguson, who comes from local boards of health. She has, I think it's twice a week, what they refer to as town halls with the local boards of health on a range of issues, and then twice a week there are specific webinars to whether it's around contact tracing or other issues that are coming up. There's a lot of active back and forth between the Department of Public Health and our local boards of health, which is one of the reasons why I wanted to thank the local boards of health for all that they do on behalf of the citizens of the Commonwealth across 351 municipalities. We are the only state that has the most decentralized local board of health system in the United States. Most states have regionalized boards of health, and we have a completely decentralized one, which is why the relationship of the Department of Public Health with all 351 communities, municipalities is very important.
Governor, New York, Jersey, moving to phase 3, I understand you're based off the data you see here in Massachusetts. But as you see sort of uptick and spread in places like California that were very careful early on, even if we have favorable data here, does that give you pause about moving to phase 3, given what we've seen in other states?
I would say that generally speaking, we've tried to stick to our knitting with respect to the data and our decision making. And I know, going all the way back to when we first started this reopening project, I actually think it was Jonathan who asked me what people's reaction to it would be. And I said some people are going to say it's too fast and some people are going to say it's too slow. Personally, I think that if we stick to the data, we're always going to have this kind of conversation where some people are going to say we're moving too quickly and some people are going to say we're not moving quickly enough. But paying attention to the data and relying on the data and creating steps in our phasing process and trying to make sure that everybody understands what the rules are and the protocols are before they're open, I think has been a really effective way to make sure that people do in fact comply with the rules and the guidance that we're making available, and that our colleagues in local government understand what the rules are and that they have the ability to do what they need to do to make sure people comply in their own communities with respect to that guidance. I think the big message I take from what's happening in some other parts of the country is you need to respect the virus. You should be careful and cautious about the way you reopen. And you should be willing to rely on a solid foundation of guidance and information that you believe people will actually comply with before you open. Because in some of the states, it's not just an issue of what the guidance was. In some states, it's an issue with respect to whether anybody complied with anything in the first place. I will say this. In Massachusetts, the overwhelming majority of employers, local communities, and individuals have complied with the guidance. It's in many respects one of the strongest and most important weapons we have in reducing the spread. And I really hope as we move forward, which is why we constantly talk when we come here about vigilance, that people stay vigilant and committed to the things that have gotten us here in the first place. That's much more important in some respects than whether it's a Monday or a Tuesday with respect to what we do by moving from one phase to the next.
Do you have any new information on this unemployment scam? I know you spoke briefly about it last week, but an update on the exact number of cases or how much the state's lost?
We're pretty closely tied in with the federal authorities on this issue because it is in many respects a federal investigation, and it is very much a law enforcement and criminal investigation, which is why it's important for us to limit how much we talk about this. What I can say is that there are 600,000 people in Massachusetts who are currently collecting traditional unemployment benefits. There are about 300,000 people in Massachusetts who are collecting the benefits made available to the so-called gig economy workers through the pandemic unemployment system. There are people who are currently in process to determine their eligibility, and that number changes literally every day. And their eligibility is very much a function of guidance and direction that we get from the feds with respect to determining if somebody is in fact who they say they are. And I really think I need to limit my comments to that.
You mentioned we have the lowest transmission rate as of that study from June 22nd, and yet there were weeks where Massachusetts may have been the worst state. Are you declaring...
Thanks for pointing that out. Really appreciate that. Yeah.
Do you think that you've made all the right moves, or looking back on it, is there something you would have done differently? I know we're not in the fourth quarter probably quite yet, but as you look back, did you make the right moves?
I think, I've said this to Secretary Sutters and Lieutenant Governor Polito. I think none of this was easy or pretty or perfect, and there are lots of things. I was here last week talking about the Holyoke Soldiers Home investigation. There are lots of things I wish we could have a do-over on. But I do believe that the thing we've done here that has worked is the people of Massachusetts, the employers, the local leadership, folks in public life, just good old-fashioned residents, have bought into a strategy here around face coverings, hand washing, hygiene, distancing, and have committed to do the things that they can do to help stop the spread. The contact tracing program has worked pretty much as intended, and I hope if we head down the road and we need to continue to invest in that, that we'll have the availability and the resources to do it. I also think part of it was we did finally find pathways to get the PPE here that people needed, and we were in a position to do a much better job of supporting our healthcare communities, our first responders, our emergency professionals, and others who are dealing with vulnerable populations and on the front lines here. We also spent a ton of time working with our folks in long-term care to come up with strategies to reduce the infections there. It's not one thing, but it's a whole bunch of things, and it's being willing, if something wasn't working, to change what we were doing and to stay in the game and to continue to work the issues. But if you were to ask me what's the biggest thing by far is the commitment that people in Massachusetts made individually and collectively to do the things that would slow the spread. That by far is the single biggest and most important thing that's happened in the last 115 days.
Thank you. Are we starting phase 3 on Jersey delaying phase 3 reopening further?
Pardon me?
With the New York and New Jersey delaying their phase 3 reopening further in light of those spikes that went across the country, people are wondering if you're considering doing the same thing.
We're still looking at the data, and we will have more to say about this by the end of this week, which is what we originally committed to.
Thanks, everybody. You gotta go.
Do you feel comfortable the Patriots play with Cam Newton?
I just hope there's a football season. Thank you.